Why do leukemia patients need a PET scan? Imagine having a tool that can see beyond just blood tests and biopsies, revealing the hidden activity of leukemia in the body. That's where a PET scan comes into play. It's a special imaging test that helps doctors get a detailed picture of how leukemia affects different parts of the body. This is especially important because leukemia doesn't just stay in the blood or bone marrow. It can spread outside these areas, and detecting that spread is crucial for planning the best treatment. A PET scan uses a tiny amount of a radioactive sugar called fluorodeoxyglucose. Cancer cells, including leukemia cells, tend to use more sugar than normal cells because they are more active metabolically. The scan detects where this sugar accumulates, highlighting areas with high activity. When combined with a CORT scan, which shows detailed anatomy, doctors get a clear picture of both where the disease is and how active it is. One key reason for using a PET scan in leukemia is to find extramedullary involvement. This means leukemia spreading outside the bone marrow, such as to the skin, lymph nodes, or other organs. Detecting these sites helps doctors understand the full extent of the disease, which might be missed with physical exams or other imaging tests. It also helps in deciding the best approach for treatment. Sometimes, patients have symptoms like fever or bone pain, but blood tests don't show clear signs of leukemia. In these cases, a PET scan can help identify hidden disease activity. It can reveal increased metabolic activity in the bone marrow or other tissues, giving clues that might lead to an earlier diagnosis. Staging the disease is another important role of PET scans. Knowing how for leukemia has spread to lymph nodes, the spleen, liver, or other organs helps doctors determine the stage. This information guides treatment choices and helps predict how the disease might progress. Monitoring how well treatment is working is also a key benefit. If the leukemia responds to therapy, the metabolic activity seen on the PET scan usually decreases. Persistent or increasing activity might suggest that the disease is resisting treatment or progressing, prompting doctors to consider alternative options. PET scans are also valuable for detecting relapse. Sometimes leukemia returns after treatment, and PET scans can spot these new areas of activity before symptoms or blood tests show anything abnormal. Early detection allows for quicker intervention, which can improve outcomes. In cases of chronic lymphocytic leukemia, PET scans can help identify a rare but serious change called Richter's transformation. This is when the leukemia turns into a more aggressive lymphoma. The scan highlights areas with very high metabolic activity, helping doctors decide whether a biopsy is needed and guiding further treatment. Finally, PET scans can help evaluate complications related to leukemia treatments, such as inflammation or infections, especially after procedures like stem cell transplants. They provide a broader view of what's happening in the body. Overall, PET scans are a powerful tool that complements other diagnostic methods. They give doctors a detailed map of where leukemia is and how active it is, helping to tailor treatment plans and improve patient care. It's important to remember that PET scans are just one part of a comprehensive approach, and decisions should always be made in consultation with healthcare professionals who can interpret the results within each person's unique medical situation.